Hello, everybody. Dr. Bob here with my COVID-19 public service announcement for March 18th, 2020. So we're seeing some new suggestions on how to be living in COVID land. The first suggestion being to make sure that you're paying attention to directions from state and local authorities. These folks are in communication with the Centers for Disease Control and helping to guide state and local health departments. So they'll have the latest information that we need to be paying attention to. All right, if you're feeling sick, stay home. Don't go to work, don't go to school, don't give an opportunity to be passing the virus on to people that have not been exposed yet. Please remember that our goal is to slow the speed at which the virus moves from person to person, to give our healthcare system a chance to handle the surge of people who are getting sick. If you do feel sick, do contact your medical provider and follow their directions. If you have children and your children are sick, keep them at home. Don't send them to school. I know most schools are canceled anyways, but don't do play dates. Don't take your children outside and give them an opportunity to pass the virus on to other people. And again, contact your medical provider. We had a bit of a scare in our house yesterday. My daughter had a fever and had a history of a sore throat for a few days. So we took her to the pediatrician, assuming the worst, and guess what? She had strep throat. Strep throat is caused by a bacteria and it is treatable with antibiotics. So I can tell you this was the happiest I've ever been to have a child of mine with strep throat. If someone in your household is tested positive for the virus responsible for COVID-19, keep everybody at home. New data are showing that the virus can survive in the environment longer than we thought it could. And people are able to spread the virus without showing symptoms. So if anybody in your household is sick, it's safe to assume that others in the house have it, so please keep everybody at home, and again, contact your medical provider. People who are especially susceptible to this particular virus are the elderly, whose immune systems, and our immune system is what protects us from all pathogens, all bacteria, all viruses. Older folks, generally their immune system isn't quite as good, so they are more likely to have severe symptoms. And people who have problems with their immune system, either because they have an autoimmune disorder or because they're on medicines to suppress their immune system, and there's a variety of conditions and drugs that can do this, these folks are also more likely to get sick. So if you fall into the category of over 60 or having one of these underlying medical conditions, be especially careful not to expose yourself to anybody who has the virus. I have a few additional suggestions I would like to share with you in this time of COVID. And that's, if possible, even healthy people should be staying indoors. We hear about social distancing, right? Giving room between other people to make it less likely that we're going to spread the virus. If you need to go out to get medical help, if you need to go out to get essential supplies, okay. But otherwise, let's try to hunker down indoors. And that brings up toilet paper. Folks, stop hoarding toilet paper. And toilet paper can go for other essential supplies too, right? So the stores are still open. Food is still being produced and delivered. Let's give those folks that are in these essential service positions the opportunity to do their job and get what we need and only go out when we really need it. Okay, communication is really important. So for my students, please check your emails regularly. I do send out regular email updates. I'm hoping to be able to scale up virtual online meetings today, and I will send that information out by email. I strongly encourage you to set up a daily routine, right? Because if you're just, woo, don't have to go to school, don't have to go to work, the tendency might be for people just to hang out on the couch and not accomplish much of anything. So I'm going to encourage you to eat. And in fact, if you can prepare yourself a nice meal, that's kind of a nice treat sometimes. I encourage you to clean up, both personal hygiene, as well as cleaning up your living space, because it's always nicer if we're in an environment that is picked up. Schedule time to do your schoolwork. You know who I'm talking to. Set up a routine, do your schoolwork, and then once your schoolwork is done, then schedule some downtime. Schedule some TV, schedule some internet. If you're a social media junkie, by all means, continue to check your social media. I would encourage you to check on people who are alone. You can use the phone, you can use other social media. Check in, make sure everybody's okay, and get them some help if they need it. We're going to get through this. This will pass. I appreciate your watching. Take care of yourself, stay safe, and see you around.